You're listening to RX Inspiration, the show where we highlight pharmacists across the country making a difference in their communities. I'm your host, Mason Manuel, and I'm coming to you from the home of pharmacy here at the American Pharmacists Association in Washington, D.C. I'm joined today by APhA President Randy McDonough, who will lead today's conversation. Our special guest today is Mark Hahn, the Senior Manager of the Advanced Pulmonary Conditions Therapeutic Resource Center at Accredo. I'm excited to hear what he has to say, so we're going to pick his brain. While you're watching, be sure to leave us a comment on what you hear today. Maybe shoot us a like and subscribe, and let's get started. Randy, take us away.
Mark, I appreciate you being on the RX Inspiration podcast today. So thank you very much for your willingness to do that. And I was wondering if you could do us a favor. I know you work for Accredo and you've been with them for a while, but could you kind of let everybody know what your position is with Accredo?
Yeah, sure. So first of all, thank you so much for the opportunity here. I've listened to the previous episodes and I'm really excited to get a chance to talk with you. So I work at Accredo Health Group. So we are one of the larger specialty pharmacies here in the United States. I really wanted to define specialty pharmacy first, if I could, just to make sure all our listeners are aware.
Please.
So specialty pharmacy typically deals with obviously specialty medications. Those are medications that are used to treat pretty complex disease states, or they'll have complex storage requirements or complex dosing. Oftentimes they're infused or inhaled. There'll be titrations, and it often takes a team approach to for patients to not only start on the medications but remain on the medications over time. So at Accredo, it's really a team approach to handle the patient care. The way that our services are broke down, we use a ton of acronyms at Accredo. One that you hear pretty regularly is a TRC, or a Therapeutic Resource Center. And that's how our patients are kind of grouped by. The Therapeutic Resource Centers kind of divide patients up by disease states. So we have 15 TRCs, or those Therapeutic Resource Centers, across Accredo. The one that I work in is called Advanced Pulmonary Conditions, and we specialize in pulmonary hypertension and idiopathic pulmonary fibrosis. So there's about 20 or 22 medications that are used to treat those medications. And we work with a team of pharmacists, obviously pharmacy technicians, nurses, both handling a 24/7 call center. We have field nurses that are training patients on pumps in their homes. They are meeting patients in the hospital prior to discharge. We have patient access representatives that are working on prior authorizations, because oftentimes these medications are extremely expensive. So they're working with the patients and the prescribers to get those prior authorizations approved. I also have a team of social workers on my team. They handle a lot of the stuff that the typical pharmacist or nurse doesn't necessarily handle. So folks that may have food insecurity or concerns about having their electricity turned off. It's not uncommon where you'll hear stories about patients having to make a decision between, should I get a prescription this month or keep my gas on, and that social worker team helps with those instances as well. So really a team approach to make sure the patients are taken well care of here.
I appreciate that. So it sounds like you evolved your roles as you've been at Accredo. So it sounds like you're at a management position right now. So what's a typical day for you in that role?
Yeah, sure. Yeah, thanks for the question there. So it's a less of a clinical role. So when I first came in as a staff pharmacist, those days were often filled with talking with our patients, counseling them on new medications, or reviewing their reorders. Oftentimes, their medications may come with, a dozen to 20 or 30 different ancillary supplies that are needed for the administration of that medication. So it's a lot of talking to patients. It's a lot of working with physicians, making sure the prescriptions are accurate and within state regulations. But my role now has certainly changed. Again, it's a senior management position. On my team, I do have some pharmacists. One of them is a lead pharmacist that kind of helps make sure that the day-to-day functions are covered. If we're getting a spike in phone calls, making sure the phone queues are covered. I also have a lead pharmacist that works in our clean rooms. We have 3 clean rooms throughout Accredo, in Orlando, in Warrendale, Pennsylvania, and then out in Tempe, and they will compound medication for our patients that may have dexterity issues or things of that nature. So they'll compound typically a week's worth of medication and get them out to the patient. So I have a pharmacist there that I oversee. And then, like I mentioned earlier, I have a team of nurses that staff a 24/7 call center. They're really in the weeds with phone calls, right? So primarily they're handling pump errors or malfunctions. They specialize and need to be subject matter experts for I think 17 pumps across various patients' disease states and the medications that they're using. So they'll triage a lot of those calls. Oftentimes, if it's anything that's out of their scope, they'll then reach out to the pharmacist, whether during the day or if it's overnight, reaching out to one of our pharmacists to handle those types of issues. And then I have the team of social workers that we have that they'll focus on patients that have challenges, around the social determinants of health, or like I said, food insecurity or housing issues, things of that nature. With pulmonary hypertension, there's a specific cause that's caused by methamphetamine and stimulant uses. So there's often a homeless aspect to those patients. So try to work with them as well to find housing, or how can we get medications to them? Because it's not easy to deliver a medication when you don't have a physical address. So a lot of challenges, but my every day is different, and I think that's what I love so much about my job.
Yeah. So a question I have, just so I have a good understanding, you're at a home base office where you're at, but it sounds like you have patients all over the country. So there's a lot of remote work that you're working with multiple providers. Can you explain from a multidisciplinary approach, how do you make that work as the senior manager of working with all these remote areas, remote clinics, and then also with the patients?
Yeah, that's a great question, Randy. And I think we learned a lot during COVID. For as challenging as that was, I think we were forced to kind of move towards this digital partnership. So there's a lot of that. So a lot of my team meetings when I'm checking in with the teams is over a Zoom or WebEx or Teams, what have you. But it can be challenging. We have 23 pharmacies across the United States. So it's working with the pharmacists that are in those areas. We have nurses everywhere across the country. Again, they need to be close to our patients. And then our social workers are also kind of sporadic throughout. So the one advantage that does give us is kind of coverage later in the day when you have folks that are out in the West Coast or in Arizona. A 9 to 5 for them is certainly different hours than a 9 to 5 on the East Coast. And I think that was a challenge that we see sometimes with companies based on the East Coast. Is there's a lot of stuff that happens after 5 p.m. Eastern Standard Time. And, we've heard a lot about that with, physicians and hospitals out on the West Coast, huge patient population. So we work with them. We, obviously improve our staffing model, and we're there to help. Again, with our pharmacies and nurses, it's 24/7. But it's using the technology that we have. I think, learning back in 2020, kind of how to do this. But it's utilizing the technology we have to really stay in touch, and I think that's a big part of it is being able to stay in touch, having weekly check-ins or biweekly check-ins, and I love the fact that we can go on camera and do that. Kind of early on, not everybody had cameras, so a lot of it was just audio, but I think having the video certainly adds another dimension to it.
Well, I can honestly say that COVID did change things a lot, including for me, not only as a pharmacist, but also as a instructor and faculty member at Loma Linda University. I teach full-time as, remote. And so I go to California for graduation ceremonies, but otherwise I'm teaching from Iowa all the way in Southern California. So technology is important. And plus, I think with the telehealth, telepharmacy, and with the technology that we have out there, I think we're just going to see more and more of possibilities with the technology of how we care for patients and even where we care for patients. So I think it's great that you guys have expanded into that space.
Yeah, I completely agree. Don't get me wrong, I'm still in the office 3 days a week.
Oh, I get
that. It's kind of odd because it's not as full as it used to be, but there's still some great collaboration that's happening, and traveling from time to time to be able to see members of the team. So
no, I appreciate that. Yeah. So you weren't always in the specialty space, I'm assuming, because I saw from your background, you've got a lot of varied type of positions in pharmacy, including being an instructor. So how did you get into the space? And then did you have to go through any specialized training or get a certificate, or what prepared you for the role?
Yeah, that's another great question. So I graduated from Duquesne University in Pittsburgh all the way back in 2003. I think I originally had plans for residency. Yeah, so going back, I knew back in high school that I wanted to do something in healthcare. And it was, kind of my own medical history that got me towards pharmacy, where my senior year pharmacy, I was diagnosed with end-stage renal failure and knew that I would have to have a kidney transplant at some point. So, one of the things that they do, when you're to prep you for such a life-changing, diagnosis and ultimate surgery, you go and meet the transplant team. And it was my interactions with that transplant pharmacist that's when I knew that pharmacy is where I wanted to be. So my goal, I had my transplant between freshman and sophomore year, a couple bouts of acute rejection, but ultimately was doing really well. And my plan to study transplant pharmacy. And then in my 6th year of pharmacy, the Monday after Thanksgiving, I was starting a new rotation. I was going to go to a compounding pharmacy in Canonsburg, Pennsylvania. I woke up with blurred vision, and that ended up being a tumor on the optic nerve. Then I was diagnosed with a stage 4 lymphoma. So the best laid plans, right? Luckily for me, it kind of fell within holiday dates and some of my off time with pharmacy school, and the wonderful doctors and nurses were able to treat me, and I ended up graduating on time, which a true blessing. I got to speak in my graduation. I was class president, and ever since those diagnoses, everything has kind of been through the eyes of the patient for me. I think oftentimes young pharmacists can take that for granted. But because I was a patient in some pretty dire circumstances, I've always tried to put the patient first and understand what they're going through. But obviously, time of graduation, I had to stay in Pittsburgh for testing and scans and whatnot. I had interned with Rite Aid as a community pharmacist all through college, and Rite Aid was a perfect fit for me. So I started in community pharmacy. I absolutely loved my time with community pharmacy. It wasn't until we had my first daughter where the work-life balance just wasn't really working out. So from there, I did move to a long-term care pharmacy. It was ended up being a manager there. They were bought out and moved headquarters. So I had to kind of pivot again. I worked as an outpatient pharmacy manager, and to kind of offset some of the costs that or the salary changes I took up and taught online, taught pharmacology to physician assistant students for a semester. Much harder work than I thought. So Randy, kudos to you. That was some long nights, checking tests and whatnot. But I ultimately knew I still wasn't where I wanted to be. I loved, pieces of everything, that I was able to take away from the various different areas I was at. And then that the managing the outpatient pharmacy really led to some pretty significant burnout. It was affecting my health, and I decided I need to take a step back. And I had a friend that worked at Accredo, and he said, you should really take a look at Accredo here. He was on our immune and complex conditions Therapeutic Resource Center, where there's a lot of immune globulins and things like that being dispensed. And so I, talked with my wife and made that decision and started here. It'll be 13 years in May. And right away, I knew, talking to these patients and the health challenges they were experiencing. I got to talk to a number of transplant patients that were receiving IVIG, and it just really felt like home. And That's always been my favorite part of pharmacy is that patient interaction, and this has just been such a perfect fit. The patients here, because of the often rare disease states that not everybody is familiar with, or the challenging or complex plans for their medication. You need to be able to take time with the patients. It's what used to be 2 minutes at the counter when I worked for Rite Aid. Now it's over the phone. It's 5 minutes, 10 minutes. Sometimes 30 minutes because it can be so complex. And I've loved every minute. Of these past 12 and a half, almost 13 years here with Accredo. And a lot of it is not only the folks that I work with, but the patients that we get to speak to.
So going into the space, then, it was just more of your experience that you brought. There wasn't any specialized training like you talked about. And I appreciate your background that you gave, Mark, because that gives me a better understanding about some of the things that you're involved in, including, the Leukemia and Lymphoma Society and also the National Kidney Foundation. So that helps me understand that. But it sounds like it's just experience that you had in multiple different places, and then going into specialty just led it right into that you didn't have to go through any kind of specialized training to get there. Is that correct?
Yeah. So one of the kind of unique things is when when I first started looking into Accredo and talking to my friend, he was like, "Oh yeah, we only really focus on 30 drugs or 20 drugs," and I thought, that's insane, right? Because at community or in a hospital, it's hundreds or thousands of drugs. I said, what do you mean? And oftentimes you're looking at the brand names or even the generic, and you're like, I don't remember learning this in pharmacy school, or maybe we spent half of a class on it, because oftentimes again it's more rare diseases that you won't typically see. I certainly see that with pulmonary hypertension. Going back and looking at my notes, I think I had a paragraph about sildenafil, and then with a little asterisk it says you will not need to worry about this, because PH was such a rare disease. So oftentimes when we bring new pharmacists in, and they kind of come from all over, some out of school, oftentimes from retail or hospital settings, those first number of weeks, it's kind of a deep dive into the disease state, the medications, the mechanisms of actions. Again, what really sets us apart, I think, is being being the experts in these conditions. With this therapeutic resource center model, we're focusing on a small number of disease states and medications, so that when a patient calls us in the middle of the night, or we've had a recent where a patient was going on vacation, they ended up in the ER, and the ER wasn't familiar with the medications that the patient was on, so they call the 24/7 nursing line. The nurse talks to them about the pump and the pump rates, and then gets them over to a pharmacist that explains that, hey, these medications are life-sustaining. Some of them have half-lives of like 2 to 4 minutes. So if they go off drug, there's a really significant risk, up to and potentially death, if we don't keep those patients on those medications. So extremely important that our pharmacists, that our nurses, are really experts in these disease states and in these medications. So that's the first part of training, is kind of a real deep dive, taking it almost back to pharmacy school. We'll often refer to it as a boot camp of just resource after resource to really become the experts of within the disease state and the medications that are used to treat it. And like I said, it's really worked out well for us. Like I said, we will typically have pharmacists that'll take calls at all hours of the night, and it's great that the patients and providers, prescribers can trust us with any questions or issues they may come across.
So, Mark, based upon what you said as far as how you got to there, and that you have this boot camp to prepare people, I'm assuming that this deep dive, this boot camp, is what's what I'm thinking of, that it's intentional. There's materials they have to read, and it's almost like you said, it's almost like going back to school and learning probably the pharmacology and the whole aspect of the disease itself. So is that how you do it, that you guys have these learning materials for your pharmacists so that they feel pretty well trained when they're all done?
Yeah, that's right, Randy. Yeah. So oftentimes, we will update it with new medications that are launched. We just had a new one for idiopathic pulmonary fibrosis back in November. A brand new drug class for pulmonary hypertension that was approved the previous year. But specifically with pulmonary hypertension, they'll have what they refer to as world symposiums, typically every 5 or 6 years, where they'll come out with new guidelines. Typically, it's the top prescribers will meet globally and kind of share their studies and prescribing habits, et cetera. And then they'll come out with kind of best practices out of those symposiums. So we'll update our documents and training materials kind of based off of that. Long ago was, a lot of patients would just start on one medication, and then as disease progressed, they go on 2 medications. Now we know, hey, it's probably better off to start a patient on 2 or 3 medications at first to slow the progression of disease. So our training materials, are updated as, the science and the knowledge behind the disease states update. So we keep those training materials up to date. Anytime a new package insert is updated, again, that gets added to the training. And it's our staff is doing a lot of the training. So whether it's our lead pharmacist or our veteran pharmacist, some that have been here 20 years or longer, we'll all join in the training. And then we typically will have a weekly meeting with newer hires, again, going over, hey, what did we learn this week? What questions do you have? And things like that. So really a kind of a multi-angle approach to training. And then we'll have them, kind of look at various orders and process them on their own. And kind of while we have another one of our leads or subject matter experts watching them, again, making sure that they're comfortable, and then kind of building brick by brick, starting with the more simpler therapies and then adding on to the more complex infused and inhaled therapies. So, but it's always kind of evolving based off of
how long does it take
through.
Yeah. How long does it take for someone through that training to go solo, where you feel comfortable with this person? Is there an average time you think it takes?
That's a great question. With us, typically we'll start them on the function we refer to as order review. So order review is basically taking the information that's been given during a reorder. So what is your dose? Have you been hospitalized? Any new medications? Any new over the counters? So on and so forth. They'll review that chart note and compare it to the prescribers to the prescription. Make sure everything kind of matches up with what they're reporting. Check for any new drug interactions, any new allergies, any recent hospitalizations or side effects. And then ultimately put their initials to what we refer to as locking the order, so that it could be printed down in fulfillment and shipped off to the patient. So we'll start with kind of that training, where a lot of it is learning, but then they'll be on their own. We're watching them, and then they may be just focusing on that function, for a number of weeks until we now stack on another function where it's reviewing the referrals. The referrals are typically the paperwork that we get from the prescribers when they're starting on a new medication. So it's not uncommon for there to be 6-7 pages of referrals. Oftentimes there's a prescription buried on one of those pages. So we're training the pharmacists on how to read the prescriptions within the referrals, how to pull clinical information from those referrals, making sure that the prescription meets the patient's state requirements. If it's a patient that lives in New York has different requirements than patients that live in Ohio. So making sure they're comfortable with that. And then ultimately we'll get them over to patient counseling. So we'll have them go over counseling guides that we have oftentimes created, with pharma upon launch or from the package insert or prescribing information. And then probably the most challenging is the phone staffing, because really any type of call can come through there. So the challenge is trying to get them exposed to the most amount of calls that they will see. Oftentimes it's drug interactions, it's missed dose counseling, it's I'm starting on a new medication. What do I need to be concerned about? But again, oftentimes it's, hey, we left for vacation and I left my vials of medicine at home, and because of the medication, like I mentioned early, especially our infused therapies, it's so important that we get medication to patients as soon as possible. So it's working on working with couriers to get medications to where the patients are going to be, or a patient got out of a shower and didn't realize their pump was off. What do I do? So there can be some really challenging interactions there over the phone. So it's sitting with them and listening to calls, having them listen to the calls, before they're truly on their own. So that can take anywhere from 5 months or 6 months, but they're still producing along the way. So it's not like it's a full training. It's learning this function, then producing on this function, then we're constantly adding kind of new skills. But it's the phones coverage, I think, where really the pharmacist is completely competent within pulmonary hypertension, idiopathic pulmonary fibrosis, and they're able to tackle every type of challenging calls. And heavens knows we've come across that pretty regularly.
This truly is a boot camp. I tell you, it sounds like by the time they're done, they're ready to go solo based upon what you just said. So I'm impressed with that. So thank you for helping me understand that better. I mean, I always say that pharmacists need to really be the drug therapy expert. You guys are really taking that in the specialty space of saying in a very specialized area, we truly are the expert. And we're helping the providers, the prescribers, and we're helping the patients understand the therapy. And I can imagine getting those calls, on a 24/7 basis. There's probably nothing you've never heard of yet, right? Because expected and unexpected.
Yeah, we've had patients on cruises. We've had patients in Europe. It can be challenging, right? And there's laws of, hey, we can't ship to Europe, and let's get it to a family member, or let's work with the Red Cross to see if they can get medication to a port or things like that. So it's, oftentimes you got to get, kind of go outside the box to solve some of it.
Yeah.
But, solving some of those challenges is kind of where a lot of the pride comes from. That's for sure.
Yeah. I appreciate that. So Mark, my last question for you is, you've done a lot within your career, but what would you say you enjoy the most during your pharmacy career?
Yeah, for me, it's always been that patient interaction, and even as a senior manager, I'm glad that I still have that from time to time. Not as often as I have in the past, but again, I think that kind of goes back to me as a patient and the care that I received from nurses, from pharmacists, from doctors, and how that's kind of set my vision as a pharmacist and how I work every day. The patients that we're dealing with is often described as, the sickest of the sick. Prior to Flolan entering the market back in 1992, the life expectancy was like 3 to 5 years after diagnosis. And now with medications, patients are living longer and longer. So these patients are oftentimes really, really grateful for these medications. But at the same time, they're challenging, right? So it's working with them, again, making sure they fully understand it, and then tackling all the challenges that come across it. Just having that winter storm a few weeks back, and some of the shippers not being able to deliver for up to a week. You're going to get some patients that are really concerned, really frightened. It's talking to those patients and giving them the best recommendations that we can, and letting them know, hey, we're here whenever you need it. So it's always been that patient interaction that drives me, and it's my favorite part of pharmacy.
Yeah, I would say what you have done is, with all the experience that you've had, is that you've taken the clinical aspects of pharmacy and applied that in addition to understanding the supply chain, understanding the cost, understanding social determinants of health, really combining all the things of what we should be doing with every single patient. You guys have done that within the specialty space, so that's very impressive. So I appreciate that. So Mark, thank you very much for your time today. Your personal story is, I think, something that really needs to be emphasized, because that was not easy what you went through. And obviously it's shaped to who you are. It's shaped of how you approach your patients. And I've just been very impressed with you as not only an individual, but also really what pharmacy should be about. So thank you very much for your time today.